Dr. Mariam Mahmood, Program Manager, National Leprosy and TB Control Program, Ministry of Health.
I mean, what is leprosy and tuberculosis, basically?
So leprosy and TB are infectious diseases that are mostly found in the tropical countries, although for leprosy, but for TB it's found all over the world. And this is a program intended to help with diagnosis, to help with treatment and prevention of leprosy and TB in the country.
At the level of Sierra Leone, where is Sierra Leone, in all of this?
So Sierra Leone is a high burden country for TB. There are 30 countries in the world that collectively report about over 80% of the cases in the world for TB, and Sierra Leone happens to be one of those countries. So this means that we have a high TB infection rate in this country. So in the grand scheme of things, we're very significant, and TB is very significant in our setting, and it's something that we all need to pay attention to and to put more efforts in so that we can reduce the level of TB that we have in the community.
How high is TB in Sierra Leone?
So for a country to be labeled as a high burden country, you have to be reporting over 10,000 cases a year. So we are estimated to have 24,000 cases of TB every year in Sierra Leone. So this makes us a high burden country. We have not done any survey to know exactly the numbers, but WHO gives an estimate for each country, and for our country we are estimated to have 24,000 cases of TB every year.
So basically, has that number been met?
So we've tried very hard over the years to reach that number. We have actually not met that number. However, last year, 2023, we had the highest so far that we've had ever in the country. We found 21,885 cases of TB, which is very close to our 24,000, but it's still not our 24,000, so we have not met our target.
How related is TB and leprosy?
They're both airborne diseases. We're not a high burden for leprosy. We have few leprosy cases in the communities. However, the issue with leprosy is that we see cases very late. By the time they have developed disabilities, that is when we find the cases. And disability is preventable in leprosy. If we find the cases early, we treat them, then they don't get to reach the disability stage. But because we don't find them early, we see disability stage, even now in kids. So that is very concerning for leprosy. For TB, it's a high transmission rate overall for TB in the country. We are doing very well with the treatment as well as the contact tracing or diagnosis for TB. For treatment, we've gone very, very far. We've exceeded the WHO target of 90% treatment success rate, because last year we got a treatment success rate of 92%. So in terms of treating patients, we do very well as a program. Just finding the cases to put on treatment is the big concern we have.
You've just spoke about treatment. What are the underlying factors, to treat patients? At what level? Community, regional, national?
So for treatment for TB is not at national level, it's at every level. So it's very decentralized. Each district has sites that are responsible for managing TB in the country. We call these sites dot sites. Each district has Makeni, we are now in Makeni, has 12 dot sites around the district, scattered around the district, that are manned with treating TB. However, when you want to diagnose TB, you don't necessarily have to go to these dot sites. You can go to any site, any health facility in your region, and they should be able to either refer you for diagnosis or at least do the diagnosis there and then refer for treatment to the dot sites.
What does it cost to be tested for TB?
So testing and treatment for TB is completely free of cost. This is courtesy of the Ministry of Health and our donor, which is the Global Fund, that buys all the drugs and all the commodities that we need to test and treat TB. So it should be of no cost to the patient for testing or treating TB.
What are the common signs of tuberculosis?
So the signs and symptoms of TB are dependent on where the TB is. TB is a very deadly disease. It attacks almost every organ in the body, but most predominantly the lungs. It can attack the kidneys, it can attack the heart, it can attack the bladder, it can attack the spine leading to paralysis, the joints, can attack a lot of places in the body, but the most common part that we see it is in the lungs. So what we look for specifically are signs and symptoms connected to the lungs. So that is cough for over 2 weeks, fever. It's usually a low-grade fever, not the high fever of malaria, but we call it low-grade fever, night sweats, and weight loss. Those are 4 of the cardinal symptoms that we look for in TB. For HIV-positive persons, the cough doesn't have to be 2 weeks old. It can be any cough of any duration. It should be checked or tested for TB.
Is it true that people who smoke are likely to contract TB?
We have not had any direct correlation with smoking and TB. That will take a lot of research to do. However, smokers are at higher risk of contracting TB because the immune system is a bit compromised, as well as the lungs are also compromised from long-standing smoking. So that means you're a higher risk of contracting TB, and also when a long-term smoker gets TB with already underlying damage to the lungs, it gets very, very bad for those individuals. So their treatment outcomes is not always very favorable. But we haven't found any direct correlation between TB and smoking.
Observation shows some people don't show up for TB treatment, not the test, for fear of public stigma. Is that something you subscribe to, or how has that changed over the years?
That has been a main barrier for the program, and I think if I'm asked to list the things that have stopped us from reaching our targets for DRTB, DSTB, is stigma. We just had a patient testimony where people are being isolated, people are discriminated against because they have TB. We've had a lot of encounters wherein people, even eventually when they're diagnosed of TB, they're in denial, they don't want to tell anybody because they will be stigmatized. And even when they are on treatment, some people hide their medication to an extent that if there are people around, they rather miss treatment than actually take their tablets in front of other people. So stigma is one big challenge that we have at all levels. Even healthcare workers that work with TB get stigmatized. So that is one big barrier that we have as a program.
What are the other barriers?
Other barriers include lack of knowledge is another thing, because people sometimes attribute TB, we call it dry cough, to witchcraft, to say, I've been a fisherman for long, or I've been under the rain, or I've been a cookie seller, I've been working with firewood, smoke, and other things. So people tend to attribute TB to lots of other things other than what it actually is, which is a transmittable disease from one person to another. So that is also another challenge that we have. The third would be limited resources to manage TB in the country.
Okay, so basically, how long do you think Sierra Leone will take to eradicate TB? Or, how soon do you think TB relevance will continue to decline?
So the theme for this year and last year has been yes, we can end TB. And the target worldwide is we can end TB by 2030. This is 2024. So we are making a lot of strides in getting TB. So I think we are positive to say the way to end TB would be to find all the TB cases, put them on treatment. When you're on treatment, you cannot pass the TB to someone else. If we can find all our cases, put them on treatment, yes, we can interrupt the transmission of TB in our communities.
Is there an estimated time of TB ending, just like HIV is projected for 2030?
Yes, so 2030 is our estimated time to end TB.
Basically, is TB curable?
Yes, TB is very curable, and it's one of the most rewarding diseases. In a sense, once diagnosed and it's actually TB, the patient starts treatment. By week 2, there are lots of changes that are seen that we see in the patient, both clinically, socially, and again, by week 2, the patient cannot infect someone else with TB. So the treatment takes 6 months for drug sensitive, and some for the resistant types you can take up to 18 to 20 months on treatment. But it's very curable, you can be completely well from TB.
Any general message?
I want to talk to us about reducing stigma for TB patients. I think if we can overcome this barrier, we can get rid of TB in our country. stigma at all levels, and stigma can be in different forms. So if we all come together and realize, yes, TB is a problem for us, yes, there's something we can do about it, yes, it is treatable, and yes, anybody can get TB, then we can reduce the level of stigma and encourage people to come out when they have TB, and at the same time take their medications and get free of TB.
Right, thank you very much.
Thank you.